So before doing this video, I'm going to go ahead and say some of the 5 rights of the patient. So this will be right medication, right patient, right time, right reason, right dose, and right to refuse. So before administering any medication, I would do both of my checks at the Pyxis, and I would, as soon as I'm getting out the medication and as just preparing it, is when I would do my second check, and then my third check would be at the bedside. So I would have my supplies, and I would go ahead and knock on the patient's door, announce myself. Hello, my name is Acacia. I'm going to be your student nurse for today. I would go ahead and pull the curtain, provide for privacy, perform hand hygiene. I want to go ahead and identify the patient. Sir, could you please state your name and date of birth? Great, perfect. Do you have any pain today? 0 being the least amount of pain, 10 being the most amount of pain. All right, great. Do you have any allergies, such as to pork or heparin? All right, great. I would go ahead and make those documentations. There are 2 medications that I'm going to have to call the physician to ask some questions about. So I would go ahead and call the physician, and I would use SBAR format. I'd first identifying the patient, so letting the physician know that that I'm caring for Miss Jacobson, and just a little bit about her case, so that way he knows who she is. And so the first medication that I would want to ask about is the enoxaparin, which says to do it at 30 milligrams, but the recommendation says to do it at 40 milligrams for pre-op. So I would want to see if he would want me to change it. He would want me to change it because that's the recommendation. And then the other medication I would call to ask about would be the morphine sulfate. It says to do it intramuscular, but I would want to do it sub-Q to avoid any hematoma. And so I would make those necessary changes. I would also repeat back the order. That way I know that I received the correct orders. So once I've done that, then I would go ahead and prepare to give the medication to the patient. So the first medication that I would get ready to administer would be the enoxaparin. Put on gloves first. Actually, the first one I'm going to do is my hydrochlorothiazide. So I would first let the patient know that this is going to be a pill. So I would want to have the patient sitting up at least 30 to 45 degrees. That way they're at least in sitting position, so not at risk for aspiration while swallowing the pill. I'm going to give them 12.5 milligrams of this pill, so I'd want to use a score tap, a pill cutter. Make sure I cut it in half. I'd go ahead and put it in a cup for the patient, ask them if they're able to swallow. Before giving this medication, I would let them know that it's to prevent hypertension. Before giving this medication, I would want to monitor fluid and intake and output, weight, blood pressure, electrolyte levels, creatinine, bun levels, uric acid level, glucose level. I would also want to assess the blood pressure if systolic is below 100. I would want to hold and call the doctor. I would also want to know if they're dehydrated, if they have any dry mucous membranes, or so forth. I also would want to give this with food, and would want to prevent nocturia, I would want to give it in the morning as soon as the patient wakes up. If second dose is needed, I would also give in early afternoon, preferably no later than 6 p.m. I would also let this patient know that with this medication, it's best to take with food to minimize GI upset. Report any adverse effects. And then just let them know that this drug can cause hypokalemia, and report symptoms such as muscle weakness, cramps, and avoid sudden posture changes to avoid dizziness. So if they need to get out of bed, to let them know to contact us. That's what we're here for, to help them. And so I would just go ahead and give this patient a cup of water and a pill, half a pill, and I would assess that they have swallowed it and everything. So once I've given that pill, then I would reassess all the pre-assessments that I made within 20 to 30 minutes. The second medication that I would give is the enoxaparin. I would want to change gloves, so I would take off my gloves, perform hand hygiene, put new gloves on. The second medication I'm going to give is the enoxaparin. I would let them know that this is an anticoagulant. It's meant to prevent pulmonary embolism and deep vein thrombosis. I would want to tell them that first, for pre-assessment, I would want to see if they're allergic to pork or heparin, which I did. I would want to see if they have any coagulation, decreased platelet count, HB levels, caution with high blood pressure, and assess for bleeding. As far as patient teaching, I would want to let them know if they notice any bleeding, abnormal bruising, swelling, fever, nausea. Avoid over-the-counter aspirin unless ordered by the prescriber, and just let them know if they have any adverse effects to let us know. So I'm going to be giving this sub-Q. And as I'm giving these medications, I would do the third check with my little scanner, which we don't have. So this is my enoxaparin. And I'm going to be giving 0.4, so I'm going to be using the tuberculin syringe. I would give this, I'm going to go ahead and give this in the abdomen, in the fatty area of the abdomen. I would want to first assess the abdomen for any bruises, so forth. So. I'll just go ahead and clean this off. And I would grab a new alcohol pad and then just clean my area, let that dry. I don't remove the syringe. I do 0.4. Okay. Sorry. Sodium. Inject air. Okay. Alright. Since this is a sub-Q, I would want to go ahead and pinch the skin and administer at a 45-degree angle. I'm going to go ahead and pinch. 1, 2, 3. Okay. I would want to not rub the side at all. That could actually cause tissue damage. I would want to go ahead and put it right away in my sharps container. I would give a Band-Aid if need be. So now that I've done that, then I'm going to go ahead and give the third medication, which is the morphine sulfate, and that is also going to be given sub-Q. Okay. So for the morphine sulfate, I would want to let the patient know that I would, this is also going to be sub-Q, but I'm going to give it behind the fatty part of the arm. I would let them know that this is for their pain. So I would want to assess their pain, see what their pain level is. Before giving this medication, I would want to assess the respiration. So if it's below 12, if it's like 10, I would definitely want to call the doctor and see if they want me to still give the medication or not. I would want to check the heart rate, ask if they have any history of sleep apnea or addiction. It could also increase the amylase level and decrease HB and platelet count. I would also want to let them know that this could cause lightheadedness, nausea, seizures, anxiety, and difficulty breathing. There are adverse reactions, and to let this know. To also take deep breaths and just not take this medication with alcohol. Encourage patient to turn, cough deep, and use incentive spirometer to prevent lung problems. And I would also want to assess their pain level within 20 to 30 minutes of giving it. So I'm also going to do this sub-Q. So I'm going to use my white needle here. First, I would want to go ahead and clean off top of this. And I would grab a new alcohol pad to clean my site. And I would change gloves in between and perform hand hygiene as well. So put that there. My needle, and this is a 27 gauge needle. Okay. I want to avoid recapping, but if I needed to, I could do it there. So now that I've done that, I'm going to go ahead and inject 0.5. Cleans my top. Go ahead and inject. I'm administering inoxaparin sodium, and the drug information guide instructs to avoid iron injection of other drugs. Okay, so she has a total hip replacement tomorrow morning scheduled, and I recommend a subcutaneous injection. Remove any air bubbles. Alright, so I've already cleaned my site. I would want to, again, since I'm giving it sub-Q, pinch the skin and do it at a 45-degree angle. So I'm going to go ahead and insert it. 1, 2, 3.
Okay, so you take
Let it go. Immediately put in my trash container. So now that I've given the medication, I would make sure to have done my 3 checks before giving the medication. Ask the patient if they need anything, and I would come back between 20 and 30 minutes to reassess the patient. I would put them back in the lowest position. Ask them if they needed anything. I'd make my necessary documentation, and that would be the end of giving the medication. Yeah. There you go.